So, dear ladies and gentlemen, I'm happy to open this topic of where we are heading to in the world of digital health and in the world of startups. So I think there will be much more to say after me, but I just open some of the issues. Now I've dropped a lot. Play.
It takes a bit of trick. Yep. You got it.
And now which one? This one.
So just,
okay. Now I found the right one. Sorry.
No problem.
So I'm the manager of the Estonian Connected Health Cluster, bringing together all the companies and public sector, universities and healthcare sector in Estonia. And I'm employed by the Tallinn Science Park Technopole, and I'm also coaching our health startups in our incubation program. So what's ahead of us? I guess we all know that, yes, we have more and more of these seniors, but in reality, they will not and are not looking like on that side anymore. So they look much different. And that's a challenge from one side, but of course, that's an opportunity for all the companies. So we can be creative. Of course, we also know that more and more are there of the chronic diseases. So again, a challenge and an opportunity for companies. And the healthcare costs are rising, and the system is not what it should be. Also, in the UK, they have measured that 40% of the healthcare delivered is a waste of money in reality. So again, a challenge, not a good thing, but again, an opportunity for all the digital health solutions. In the chronic disease field, we know that a big part of chronic diseases are avoidable and can be prevented. And we all know this, that we can live a healthy life, eat and do sports and so forth, but it's not an easy thing in most of the cases to do. So we don't follow that. And in reality, we in many cases underestimate our ability to live a healthy life. We think it's easy. And so what the doctors say is that the patients are in reality unwilling to change their behaviors. Although they have a bad disease, they have a threat to die, but it's still in many cases not enough to take that hard job and change their behavior. So digital startups have the opportunity to contribute to help the people to change, make it easier, make it more fun. So the good side is that in reality, a big part of people are using already nowadays internet to look information for the healthcare. At the moment, the majority is Googling, and we know that's not always the good thing to happen. Again, we as clever startups can help the people to find right data at the right place in a nice way. So as said, I come from Estonia. So where is it? It's in the north. There is really cold there, and we just saw a picture that there was snow in the morning. So but it's still south from Finland, not north, and west from Russia and north from Latvia. So there's this strange country of Estonia. But what we've managed to do there is that we really live a digital life also in health. As you see, the data in the hospitals and also in GP offices is really digital, so we don't use paper. All our people have digital health record that we can access online from wherever we are, and we own this data. That's our data that we have there. Also, the young generation doesn't know anymore what is a paper prescription. We all do it digitally already several years. And also the doctors can enjoy it as they don't need to send papers to get paid for their job, but it all happens electronically. So this is what it used to be, and in still quite many hospitals we have these paper files about patient summaries, and we somehow think that that is very secure. But in reality, we can never prove that that doctor is not looking at my data and not showing it to anyone. That's not provable. but we've somehow are used to think that that's very sure. For this solution, we somehow are very much afraid that someone technologically can somehow get in and see what's going on. In Estonia, each person having its digital health data can see who has looked his or her health data. And if there is a doctor that I didn't turn to, then I can sue him because she or he had no right to look at my data, but I can see it online all the time. So for the startup side, there is more than 100,000 digital health startups. And as we heard today, 24 cases from Greece, so no big surprises. You're doing quite the same things as the other 100,000 startups. But so it means it's growing very fast, there is the need, but still the boom of getting them really applied and people using it is still ahead. As really only a fraction of those 100,000 startups are cash positive and really earn income, are users for a long time that are paying for their work. So what kind of short things I can bring out to you to execute it well and do your startup thing and start to earn money for what you do? So I think the first thing is that we cannot assume anything. In many cases, we think that if I'm the, let's say, diabetes patient, then I know everything about all diabetes patients. Or if I want to live a healthy life, everybody wants the same way, but that's not the case. I am an exception. So we cannot assume things. We need to test it from the first day and do the product together. But in many cases, we do the same mistake and start to develop things that we believe that's needed, but we never ask anyone else. The other is, of course, then that when you think that there is the need, I have that need, then do the development from day one together with the users. Involve them in your team, that you develop it together and constantly test it with them. Again, don't assume that what you do is very nice for them. Test it. You can do many things much earlier than you start programming, and that's very, very beneficial and can make you the first one to succeed. So as told before, so quite a lot of this digital health is changing our habits. We all want to live a healthy life or live with our chronic disease, but that means that we need to change our behavior. But that's very difficult to do. As, yes, we in many cases have the motivation, okay, I do it tomorrow. So maybe tomorrow you do it, but in a week you have your habits and you're used to do it in other ways, so you forget it. So it's very difficult to change your behavior. So how we can do it? So luckily the technology in reality, when to use it in a right way and take again into your team those behavioral scientists or behavioral psychology people that can help you to make these mechanisms work, and that's continuous work. It's not that you make your app ready, you have to have your whatever challenges, games, and it has to change. Otherwise, you again lose your users. So there are these good engineers that can create a formula about everything. So here's a mathematical formula how you can engage your patients and get them using your tool forever, let's say, so at least in the startup sense, forever. So be very conscious about it and take it. It has to be really easy to use, not too easy. Otherwise, it's also very easy to quit. But keep in mind that this is motivation that gets you started. You think you want to get, I don't know, thinner, manage your lifestyle well, get rid of your certain disease, that gets you going, but that this is the habit that gets you using it. And habit is always done unconsciously, so you need to do so many repetitions that you don't even think anymore that you do in that way. So you need to motivate the person, have your app or digital solution so thrilling that it keeps the person with you until it becomes his or her habit. So a good example of a very successful diabetes startup worldwide that earns profit and has 800,000 users worldwide. So they are really very patient-centric. The main aim they say is that they want the diabetic people or diabetic patients smile, and that's the reason they have such funny guy there. And a big thing they said they succeeded, that they had a guy making a tattoo on the hand with this funny guy there that they have in the logo. So in their team of 43 people working in this company in US and Austria, 13 have diabetes. So they have the passion inside their team. They do it also for themselves, so they know what they're doing and they're passionate about it. So it means that they try really to make it fun for you and also personalize. Like, for example, like each new client they involve gets a personal email from one of the guys there with diabetes, saying that, you know, I have the same problem. Initially, they did it really writing emails. Now, of course, there is a machine in behind, but you still get this email that really you feel that's written for you, to engage you, and they keep doing that. So as to sum it up, there is, good times ahead. I think it will happen. In one of our seminars, we found out that the age limit is around 30. The people more than 30 years old, they think it's normal that when I have a problem, I go to the doctor and he or she will tell you. The people under 30 say, no, if I have a problem, I Google, and if really nothing else to do, then I finally go to the doctor. And preferably, I go there tomorrow and pay for that. So there is about the limit. And as I come from Estonia, so in Estonia you can become an e-citizen. So welcome to this e-country to enjoy all the e-services, including eHealth, that we can do there. And yes, please contact me, and happy to cooperate with Greeks and all other people in the world to make it a healthier place. Thank you.